Hey, this is Delitra,
Hey, everybody, this is Angela,
and you're listening to Nutrient Sisters.
a podcast dedicated to helping you learn how to nourish yourself. Welcome back to another episode of Nutrient Sisters. I'm Angela and Delitra. Why don't you say hi to the people?
Hey, everyone, it's Delitra.
So, today we have a very interesting topic. Maybe it's something that not many people know too much about, or perhaps you've known about it, but you didn't really know the technical terms for it. We are talking about food swamps and food deserts. Now, I must admit, these are terms that were sort of new to me up until college. We took a course together. Do you remember community nutrition, Delitra?
I do. I love that class.
Right. So that's where I was first introduced to this complicated and somewhat upsetting topic because
Yeah.
during that I had to sort of sit and recognize my own privileges and understand how it didn't quite
Mhm.
affect me in the way that it does others. But before we dive in, Delitra, why don't you tell us what a food swamp is and what a food desert is?
Yeah, of course. And I have the similar sentiments. Of course, in college, I learned about these things, especially food desert, but food swamps are something that concept is new to me. So I was glad to learn something new. But a food swamp is described as a community where fast food and junk food overwhelm healthy food options. So in this instance, there are more fast food restaurants or convenience stores than there are grocery stores, farmers markets, or other areas where individuals purchase healthy foods. So, on the other hand, a food desert is defined as a residential area with limited access to affordable and nutritious food. So, where can you find these areas? So, for a food desert, the USDA measures the distance between people's homes and supermarkets. So the USDA indicates that food deserts are areas with poverty levels of at least 20%, where a minimum of either 500 people or 33% of the population lives over a mile from the nearest supermarket. It noted that residents in this area usually come from low income families and low income neighborhoods, as well as households without access to a personal vehicle. And that's so interesting that Angela's talking about privilege. I live in an area now where I'm middle income, but I live around a lot of people that are wealthy. And it was surprising to me to find that there was like 5 grocery stores within like a few miles of each other. So everywhere I turned around, there was a grocery store. So this area has a lot of access to healthy foods. So I could not find a specific assessment to measure food swamps. But what I did find was research that provided evidence that fast food restaurants are more likely to be located in areas where there is a higher concentration of low income and people of color. And Angela, can you share with us some of the effects of someone living in communities that are identified as a food desert or food swamp?
Right. So, I mean, you said it best, right? These are low income areas where black and brown bodies are primarily present.
Yeah.
Now, with limited access to supermarkets and fresh, nutrient dense foods, you're looking at a stronger link to poorer diets. So, think obesity, think high saturated fats, high refined grains, high sugar intake, less fruits and veggies, less iron and fiber. I mean, the list can go on. Now, in correlation, these are communities that also have a lower physical activity level, right?
Mhm.
This is usually due to high crime, low walkable areas, low playable, I guess is a word,
Mhm.
areas.
Yeah.
So it's like a domino effect, right?
Yeah.
Now, as nutrition professionals, you and I know that there's a higher risk for type 2 diabetes,
Mhm.
cardiovascular disease, hypertension, which, for those who don't know, is just the medical term for high blood pressure, dyslipidemia, which is high amounts of lipids in the blood. All of these conditions are catastrophic to our health and lead to shorter lives for a lot of people in these communities. And it's a cycle. It will continue on for generations because
Mhm.
their circumstances don't get much better, right?
Right.
Because let's be honest.
Yeah.
These communities are also tackling poor school systems
Mhm.
that aren't able to educate the youth of these communities in the same way as their white peers from other school districts.
Yeah.
And Eh, I mean, why do I bring that up? It's because, again, it's a cycle. If they're not learning any other way to live and eat, then they can't draw attention to the disparities that are affecting them, and the fast food industry can continue to saturate these communities with terrible foods, and they can do it and go about their business because who's gonna be there to tell them any different? Who's gonna stop them?
Right.
And and we know that there's also a brain to gut connection. So don't even get me started on the mental health issues that affect our
Right.
communities
Yeah.
that we don't talk about,
Yeah.
depression, anxiety, for example, because those are also connected to what we eat. So
Sure.
it's a lot.
Yeah.
It's a domino effect, as I said.
Yeah. And thinking about what you just said, I thought about the um the economic abilities that low income and people of color have is, lower than whites generally. So it's not like they can just get up and move, to a
Right,
better school district or area where there's access. And if they have transportation issues, you know, they they literally can't go anywhere else. So
right.
it's kinda like being a victim of your circumstances.
Exactly. And that's the thing. I mean, it's like you then have to question, well, how do we fix this? How like is there anything in place that's trying to help? Because from an outsider's point of view who might not know what the heck's going on, we're like, "Oh, nope, we're just continuing to let this happen and there's nothing really going on to help." So,
Sure.
Delisha, do you know of anything that's really going on that is helping
Yeah,
change this?
yeah, and, back to what you said earlier about us kinda being in that circle, I feel like we're probably more aware of things than the general person in the community. Um It was
Right.
reported that there needs to be collaboration among the public, so you and I, private businesses, nonprofit, agencies to make, um, the needed change that we need to improve access. So the first thing, that is available to support this initiative is financial assistance. So there is financing such as grants, loans, or other forms of support, like more tangible, like technical assistance that helps projects that will improve access to fresh and healthy foods in underserved areas. For example, they could finance a project that's in place to bring a grocery store to the community. So that would help out a food desert. And there's other different things depending on the project that you have that you can apply for financing. Another initiative is health education. And of course, as health professionals, we are a part of that initiative. So there's nonprofit organizations that provide health education, government agencies such as SNAP Education and WIC. They provide health and nutrition education in various settings about purchasing and cooking healthy meals. And I found a study about food swamps um, and how sometimes that can be in areas where people have a higher income, but the problem is their perception about healthy food, versus fast food. In that study, it was a qualitative study, I think when they had the comments, there was a
Right.
perception that fast food is quicker and cheaper, and certainly it is more
Yep.
convenient because someone else is cooking the food. You can't beat that. um,
Right.
but it's a myth that you can't cook food at home with a similar price point to fast food, or that it's necessarily quicker. I'm just like everybody else. I've been in a drive-through line for about 30 minutes before waiting for my food.
Dang.
And I could have spent the same 30 minutes making food at home, saving money, potentially healthier. So,
Yes. Say it louder for the
yeah.
people in the back.
So that's where health education comes in to educate, others on alternative choices, budgeting, as well as cooking skills to kind of help with that. Another initiative are healthy retailing initiatives. So I talked about food swamps and how there's a greater percentage of fast food restaurants and convenience stores. So, a healthy retailing initiative, there are programs that partner with corner stores or gas stations to bring fresh food into neighborhood stores in underserved areas. So, examples of that would be fresh food, including fresh fruit, vegetables, and some organizations are even making healthy, ready to eat meals, which makes the healthier option easier for someone to do. And some programs I'm aware of locally are Virginia's Healthy Corner Store Initiative, DC Central Kitchen, which provides this service in food swamps. And there's possibly some programs that our listeners know as well. And I know Angela is aware of a study that's specific to Baltimore, I believe. And can you share with us what you found?
Yeah. So did you ever take a public health course
Yes.
in school? Yeah. So I took one and this was like the main study that I still remember to this day.
Mhm.
So it was called the Baltimore Healthy Carryout. Now, for our listeners who don't know what it is, researchers looked at a low income urban area of Baltimore where carryouts and fast foods were really prevalent. What they did was they studied the community and they tried to implement culturally appropriate interventions to promote healthier eating. Okay, that's
Mhm.
like in essence what it was. So, what they did was they changed some of the menus by adding a leaf next to healthier options. Um, Carryouts were given monetary incentives for keeping new stock items like yogurt, and even with newer cooking tools like a grill instead of a fryer. Um,
Mhm.
Promotions for fresh combo meals were equal to the price of other combo meals that didn't offer those fresh ingredients. These are just small highlights. I'm probably not doing that much justice, so I recommend reading more about it. But the results of that study were pretty significant. I mean, for one, the purchases increased by 36% within those couple of weeks to months that they actually incorporated this initiative, right? Um, so this is just one example. I mean, you have similar that are being performed in Montreal, Canada. There's one in, and I hope I say this right, Salinas, California.
Mhm.
Um, you have healthy restaurant programs around the United States, farmers markets, which allow WIC and SNAP to be used. I mean, all of these initiatives are slowly trying to figure out how to incorporate healthier options into these communities. And I know that you've mentioned and community gardeners.
Yeah.
Not only do they work to provide fresher ingredients, but they're also teaching the youth at the same time, which is pretty vital.
Yeah.
Um, and then you have, the Bedford Park Community Fridge program, and there's many like them, but this one specifically in New York. And that's giving people access to fresh foods. It's fighting for food security for many, and it's even tackling food waste. Thanks to a lot of activists like Jazz Johnson, who is the founder of East Harlem's Refrigerator. Um, so there are things that are being done, that are being implemented, and I said this to you before we started. I said, these are everyday people.
Right.
Jazz Johnson is an activist. This is an everyday person. Where is our government in all of this?
Yeah. Yeah, and those programs, that you just mentioned with the community gardens and community fridges, that's so great that the local residents are getting together to, look out for their own, and it makes you wonder, what is the government doing since that's their job to look out for everybody?
Right.
And I will say again, like I said, we're in kind of the circle. I probably wouldn't know this information if I had not worked for community nutrition programs before,
Okay.
but a government initiative, going back to what I said with the healthy retailing initiative in Virginia, that's a government program. You talked about the vouchers that individuals can receive to use at farmers markets. So the WIC program, they provide, I believe, it's a check that they get. It might be a card now. I know they changed to different, um, EBT forms.
Right, right, I'm not
Um,
sure.
yeah, but an example of a voucher is, Health Bucks, which that's a benefit where you, if you spend at least $5 of your SNAP benefits at the farmer's market, you get a coupon to purchase more fruits and vegetables for free, basically. So
Nice.
you're getting more bang for your buck. So that's just for anybody that has SNAP benefits. The USDA also has a seniors farmers market nutrition program, and that is designed to provide low income seniors with access to fruits and vegetables, honeys, and herbs. So, kind of similar to Health Bucks as because it's a voucher, so they get a
Right.
voucher as well. But I don't believe that the seniors have to have SNAP benefits or spend a certain amount, to qualify for this voucher and then get free fruits and vegetables. So
Okay.
when I looked on the website, it's you just have to be a senior who is at least 60 years old and have a household income of not more than 185% of the federal poverty income guidelines.
Huh.
So if you already fall within that category, please look into um, these programs and use them. Angela and I were talking before the podcast. I think a lot of people don't know about these programs, or they may know a little bit, um, but they're apprehensive to use those benefits.
Right.
And what happens is the government is like, "Oh, we're wasting money here. And nobody is using this money. We're gonna put money in our other interests because they don't fall within these categories of low income."
Okay.
A lot of politicians don't care, really. I mean, they say that on their platform that they care about us, but a lot of times they're interested in what benefits them.
Mhm.
So
Mhm.
we have to increase our awareness as well as use the programs, if you qualify, um, as well as talk to our politicians about more ways that they can be accountable to helping out our general population.
Right.
So there's some stuff, but of course, there can always be more because they work for us.
True.
So, they can always do more.
Yes.
Um,
They definitely can.
yeah, another initiative I wanted to talk about was, I guess I would classify this as healthcare collaboration. There's something that I was made aware of when I did my dietetic internship, which are called pharmacies. So instead of the P, it's PH. PHA, it's FARAMAC, so
Yeah.
pharmacy.
Right.
So with this program, I'm aware of the Farm RX program. This promotes affordable access to fruits and vegetables and healthy eating in underserved communities. And they do that through partnerships with local healthcare providers and community organizations. So in this instance, say a patient comes to a doctor with a problem that can be addressed through healthy eating. So instead of writing a prescription for medicine, they would write a prescription for fruits and vegetables.
Oh,
And
boy.
with that prescription, the patients can redeem them at their local farmers market,
Hell
which
yes.
is a win-win for everybody.
That
So
is.
it's an awesome program that I wish was in more communities. I'm aware of Georgia, Athens, Georgia, and I believe Augusta, um, administers this program, and there's probably some nationwide, but they work with the doctors, they work with the residents, so those that are studying to be a doctor, to help out the community, support access. I'm sure a lot of the patients that they encounter, um, where they write prescriptions don't have access or money to afford fruits and vegetables. So this is a great program that benefits everybody. So they're getting healthier, they're saving money,
Yeah.
doctors are helping to make long lasting impacts. So that's probably not an exhaustive list of what's going on, but let's talk about some activities that we currently participate in. Angela, are you aware of? Well, do you engage in any activities that support um, change in this area, or are aware of any programs that help to support to improve access?
Right. So here's the thing. So personally, I follow a lot of accounts on social media and I continue to advocate for a lot of these initiatives online. I think social media it's such a huge platform and that's really
It is.
how we're able to connect with a lot of people from various
Yeah.
different backgrounds. Um
Hmm.
so I would say that that's one way. I would say another way that I've personally been trying to is I've actually started volunteering at my local free clinic. Um
Oh,
yeah, and I
yeah.
did that in order to kinda combat the lack of nutrition education,
Okay.
um, and, I'm really glad that I did that what the woman that's sort of in charge of it, she when I went to go meet with her, she was just like you could tell there was such a desperate need for someone like me,
Yeah.
um, that she was just like, "I'm willing to do whatever you wanna do, just tell me what you wanna do." And I was like, "Okay, that's great."
Yeah, yeah.
But I'm constantly trying to figure out how to sort of better serve my community,
Mhm.
um, and I talk when I think about it, I also kind of think about, the Black Lives Matter movement,
Right.
which is very strong, um, it highlights police brutality a lot, which is significant, as they should,
Yeah.
um, but it's something that I think about a lot when it comes to our health, as it relates to nutrition. I think that it should be a larger topic when we talk about Black Lives Matter
Yeah.
because it is something that really affects our community.
Mhm.
Um, and I have to be honest, like when I work with clients who are people of color, I get a lot of pushback. I get so much pushback because let's be honest, it's not just low income, right? This is a
Yeah.
top and this is a topic for another day, but you have black and brown bodies who are educated,
Mhm.
who are well off, and I think you talked about this earlier. They can purchase nutrient dense food items. They live in good areas where they have access to supermarkets and things. Um, but there's this joke that, we know how to season food and we know how to eat well and so on and so forth, but we're still being affected by these same health conditions that I talked about earlier, type 2 diabetes, cardiovascular disease. Um,
Right.
so for me, it's a little bit of trying to figure out how to support and change both of these systems,
Mhm.
um, because I think it has to be done on both sides, right?
Right. Yeah.
So, that's kind of where I am. I'm like, I'm stuck. I want to help those in need, but I also see that even people who you wouldn't typically think are quote unquote in need are still in need. So,
Yeah.
it's like
That's what makes this issue so complex, and I think to that point, this is just my opinion, I think, there's a well, we know this, maybe not a lot of people know, there's a lack of representation
mm,
in the healthcare field. And with that, then someone from another community promoting foods that are not culturally relevant to whatever culture, it doesn't seem approachable.
Right.
So it seems like you can only eat this way. I can only eat avocado toast or Brussels sprouts, and,
Right.
everybody doesn't like that, or that's not a part of their everyday custom in their recipes.
Right.
So, it helps to see a familiar face or somebody that cares to give individualized, advice on, like, "Okay, so this is what you're working with. How can we make healthy choices within the foods that you like to eat?"
Right.
So,
Right.
it's kinda going back to health education and how that's important. I didn't think about, volunteering at a free clinic. That's a great way to, help support this change. Me personally, I've always been interested in working with organizations that fight hunger, so
Nice.
whether that's like a soup kitchen, um, I've also volunteered with different food banks and food pantries. I forgot to mention that that's another initiative because food pantries and food banks do get donations from farmers,
Mm.
and they're able to provide some fresh food to their participants, as well as sometimes they do healthy food drives. So they ask for healthier canned foods or non perishables that can support the health of their clients. So part of that, also social media, which you were talking about, I can't express how important
Mm.
that is. It seems like it's not a big deal, but in the day and age that we're in, it's so powerful.
Yes.
Like, we've seen so many examples of how social media has increased awareness and visibility.
Right.
With that, you can put pressure on organizations to make change. That is
Yes.
so relevant right now. So, to make change as well as to make you aware of the community fridges or the community garden that's local to you that you can help volunteer with. So continue to share and post about and research different organizations that are making change. Another thing, if you have the financial means, you can donate
Mm.
to the causes that are available. Um, you can also join different groups that discuss and strategize on how to improve food access. So those are like food councils, um, I think they're also called alliances, whatever they are. They're a community-based group that has different organizations and individuals that promote resilient food systems. And if you are a health professional or in that field already, or maybe some private organizations that have an initiative to give money or to support those initiatives, you may be able to use the time, your attendance and membership at this group as work time as well. So
Yeah.
you know, you're kind of making the most out of your work hours. Also, I want to talk about signing petitions to
Yes.
support change. So we know now with the Black Lives Matter movement, Breonna Taylor and stuff like that, signing petitions to show people like, hey, we want this to change. Listen to us. We care about this. So that puts pressures on them. Writing and emailing your members of Congress about social determinants of health, urge them to advocate for programs and funding to support food access. Because, like I said, they work for us. And believe it or not, it works. I've written mostly emails because I'm more of the newer generation, and they write back. They're like, okay, I got your email
Oh,
about
okay.
whatever it is. Don't hesitate to reach out to me again. Like, that works as well. Um, I think the last thing that I can think of is if you have an original idea, pursue that. There may be something that we didn't talk about today that you have an idea that can help to support change. And you never know, this could be very innovative and your impact can make a lasting impression on your community and nationwide. So pursue that idea.
I yes, that's a good one to end on. And the thing is that I really like that you touched on the political aspect of it because the sad reality is that food is political. Um and I don't see it changing anytime soon. So the fact, if we can also kind of educate ourselves or on who, our congressmen are, who our House of Reps, like who these people are, emailing them, calling them,
Yes, calling as well.
getting on their social media. A lot of them have social media,
Yeah.
DMing them, messaging, doing whatever it takes to kind of get these initiatives out there, to get the education out there, the knowledge, then that's also just so important and I think it's really great that you touched on that.
Yeah, and when you said that, it made me think of, like, lobby days. I believe that there's, an option also for the public. I know different organizations, they will go, so, for example, I went with, a dietetic association. We had a lobby day where we met with our representatives, and we talked to them personally about different programs and initiatives that we wanted them to support. Some came and had lunch with us. It's really good to make, a connection that way, face to face, if you're comfortable with that. That's an option as well, and I believe they have some days where the public, of course, organized, can come and speak one-on-one with your representative. So,
Okay.
I don't wanna forget about, that as well. So if you're a talker and, you have everything organized together, that would be great, and, that also reminds me of different conferences that are available. I know I went to, a food justice conference
Nice.
and the mayor of the city was there, and he was taking questions. So,
Okay.
that's another opportunity to be, in the presence of someone that can really make some change. So use your voice to, um, impact this problem.
Right. And I would say that also, if this topic that if the topic we discussed today, if that is something that you've never heard of, this is totally just left field for you. I would say, continue to educate yourself. I mean, we're a really great podcast, obviously, wink, wink. But I would say also that there's documentaries, there's scientific articles that you can read. There's just going online, following people, just to kind of get your knowledge base, increased a little bit. Um, if this is something that you're like, wow, I didn't even know that this was happening.
Yeah.
But I don't know, it's a lot, Delitra. I feel
Yeah,
like
it's a lot.
every time we talk about something, we can always talk about other things, but we don't have I don't wanna, like, sit here for 3 hours and talk to the people about about all these things, so it's
Yeah.
crazy, it's hard, but I would say, to our followers listening that they should just continue to follow us and support us because we are gonna talk more in depth about a lot of these conversations, so
Yeah, and if you guys, want a part 2 about any, little mini topics that we talked about, we're open to make another episode. So we challenge you to take at least one of these actionable steps that we just mentioned. We invite your comments and questions regarding this topic. Also, share with us what's going on in your community to create change. We would love to highlight that success story. In the meantime, follow us at Nutrient Sisters on all social media platforms: Instagram, Facebook, Twitter. Please rate and review our episodes, because that increases our visibility to other people. So, thank you for joining us for another episode. Until next time, bye everyone.
bye.